2, 1. Disclaimer. I do not own the rights to the images or information provided. This was strictly made for the purpose of studying for boards. Embryology of the eyeball. The eyeball, bulbous oculi, is derived from neuroectoderm, retina, surface ectoderm, lens and cornea, and mesoderm neural crest, cornea, sclera, and uvea. In the bird, ectodermal neural crest contributes to the cornea, sclera, and uvea. The amount of contribution of neural crest in the mammal remains to be determined. The neuroectodermal contribution to the eyeball is induced in the neural plate stage at its rostral end on the median plane just before closure to form the neural tube. This portion of the neural tube is destined to form the prosencephalon and subsequently the diencephalon. This initially single primordial optic field area, eye field, located ventrally in the developing prosencephalon, is influenced by the adjacent head mesenchyme, which includes mesoderm and neural crest cells. This portion of head mesenchyme is rostral to the notochord and is therefore designated as precordial mesenchyme. The morphogenesis of the eye is controlled by the PAX6 gene, which is expressed by the precordial mesenchymal and neuroectodermal eye fields. Sonic hedgehog is the signaling protein secreted by these cells that has a diverse role in this morphogenesis. This signaling molecule plays a critical role in establishing the bilateral eye fields from the initial single optic field area of neuroectoderm. This area first appears as two depressions within the neural tube, the optic pits, in each half of the initial prosencephalon. They proceed to grow laterally as evaginations from the neural tube known as optic vesicles. Figure 14-1. Evidence in lower vertebrates indicates that the prosencephalic cells that contribute to each optic vesicle come from both sides of the prosencephalon. This arrangement may relate to the subsequent development of the optic nerve axon crossing at the optic chiasm. Improper separation of the single optic field area into two primordia by the precordial mesenchyme leads to the development of the cyclopic malformation with a single median plane eyeball. The veratrum sp cyclopamine alkaloid ingested by the U interferes with the action of the sonic hedgehog molecule, which results in the cyclopic malformation in the offspring. This occurs specifically at 14 days of gestation. See Chapter 3 for a description of this malformation with the brain malformation holoprosencephaly. The optic vesicles bulge laterally from the prosencephalon and lie adjacent to the surface ectoderm, where these optic vesicle cells proliferate and induce the surface ectoderm to form the lens placote. Differential growth in the wall of the optic vesicle results in the invagination of the portion of the optic vesicle adjacent to the lens placote. This enfolding and the more rapid growth of the outer wall of the optic vesicle result in the formation of an optic cup. As the optic cup grows away from the prosencephalon, its connection elongates into the optic stalk, which is the precursor of the pathway of the optic nerve. The optic cup is incomplete ventrally while the optic or choroidal fissure forms. The embryonic hyaloid vasculature enters the developing eye through this fissure. In time, fusion of the edges of this fissure will close the fissure, except for a small notch. The enfolding that produces the optic cup also involves the optic stalk, which provides a pathway for the optic nerve axons to enter the brain. The two walls of the optic cup differentiate into the two portions of the retina. The outer wall will become the single cell thick pigment epithelium of the retina and the inner wall the multilayered nervous layer of the retina. As the optic vesicle invaginates to form the optic cup, the lens placote that is developing in the surface ectoderm also invaginates to form the lens vesicle, which ultimately separates from the overlying surface ectoderm and remains located at the opening of the optic cup. A fine fibrous connection remains between the inner wall of the optic cup and the posterior surface of the lens vesicle. The anterior cells of the lens vesicle remain cuboidal. The posterior cells elongate to form the primary lens fibers that eventually obliterate the cavity of the lens vesicle. These primary lens fibers lose their nuclei and become the embryonic lens nucleus. The anterior cuboidal cells remain as the lens epithelium. Proliferation and elongation of these cells around the equator of the lens give rise to secondary lens fibers. These fibers grow anteriorly between the anterior epithelium and the embryonic nucleus and posteriorly over the embryonic nucleus beneath the lens capsule. Secondary fibers are continually formed at the equator for the life of the animal. The characteristics of these lens fibers impart transparency to the lens. Congenital cataracts develop in the primary lens fibers of the embryonic lens nucleus. The lens is thought to be partially responsible for the induction of the remaining surface ectodermal cells to form the surface epithelium of the cornea. A rare malformation in cattle is the development of a rudimentary ectopic lens within the cornea. This malformation results from the failure of the lens vesicle to separate from the surface ectoderm that ultimately forms the corneal epithelium. As these primordial ectodermal structures are forming internal components of the eyeball, a component of mesodermal neural crest is added to the external surface of the optic stalk and cup. This structure may be considered an extension of the two supporting layers that are formed around the entire central nervous system, the dense protective neuro, and the thinner vascular pyarachnoid. Figure 14-2. As the loose mesoderm neural crest surrounding the brain differentiates into the vascular pyarachnoid, leptomeninges, this process of differentiation continues along the optic stalk and over the optic cup and lens vesicle. The subarachnoid space found between the pia and the arachnoid over the brain continues along the optic stalk to the posterior surface of the optic cup where it stops. This subarachnoid space is implicated in the spread of disease between the brain and the eyeball. At the optic cup, this space is obliterated, and the mesoderm neural crest, homologous with the pyarachnoid, differentiates into the uveal coat of the eyeball, choroid, ciliary body, and iris, and forms the endothelial layer on the posterior, inner, surface of the cornea. This initially loose mesoderm neural crest completely fills the area between the lens vesicle and the corneal endothelium. A space forms in this tissue, leaving the mesoderm neural crest anteriorly as the corneal endothelium and posteriorly as the body of the iris and pupillary membrane. This space is the anterior chamber, which fills with aqueous humor. The pupillary membrane is the mesoderm neural crest located centrally over the lens. Ultimately, it disintegrates to form the pupil. Abnormalities in this disintegration result in a persistent pupillary membrane. This condition is thought to be inherited in Basenji dogs. The space formed in the mesoderm neural crest between the iris and the lens is the posterior chamber, which also fills with aqueous humor. The uvea is the vascular tunic of the eyeball that at the optic stalk is continuous with the pyarachnoid, the vascular tunic of the central nervous system, CNS. The cells of these layers have some similar histologic characteristics. The space between the inner wall of the posterior portion of the optic cup and the posterior surface of the lens is the vitreous chamber. The vitreous body that fills this space is derived from secretions from the optic cup, the lens, and the enclosed mesenchyme. Hyaloid blood vessels course in the mesoderm from the base of the brain along the optic stalk in the optic fissure to supply the optic cup, vitreous, and lens. Branches of these blood vessels course through the vitreous to the posterior surface of the lens. These hyaloid vessels normally disappear after birth. Remnants may persist in dogs to around 4 months of age and in cattle until 1 year or more. These remnants are seen emerging from the optic disc that forms at the site of the optic stalk. Abnormal persistence of this hyaloid vasculature to the lens results in the development of cataracts of the posterior lens capsule and an accumulation of blood pigment and fibrovascular tissue posterior to the lens. These lesions are called persistent hyperplastic tunica vasculosa lentis and persistent hyperplastic primary vitreous. A hereditary basis has been suggested for this disorder in the Doberman Pinscher, as the outer layer of the mesoderm neural crest surrounding the brain differentiates into the dense patch hindlinks, the DRO. This process of differentiation continues along the optic stalk and optic cup. Over the optic cup, this layer forms the fibrous tunic of the eyeball, the sclera. It continues anteriorly deep to the surface ectoderm to form the substance of the cornea, the substantia propria. Thus, the fibrous tunic of the brain, the DRO, and the eyeball, the sclera and corneal substantia propria, have a similar origin that reflects the initial origin of the eyeball from the neural tube. Differentiation of the optic cup is similar to the differentiation of the neural tube, with two adjacent walls separated by a neural canal. Figure 14-3. See also Figure 14-2. The wall of the optic vesicle originally consisted of a single layer of columnar neuroepithelial cells, similar to any other component of the neural tube. These cells were rapidly proliferating neuroepithelial cells, as the lumen of the vesicle is reduced to a small space by the unfolding of the anterior surface. This area forms an outer wall and an inner wall to the optic cup. The differentiation of each of these walls may be compared with that of the neural tube, with the formation of germinal, ventricular zone, mantral, and marginal layers. The entire outer wall of the optic cup, which initially proliferated, later regresses to a single layer of cells, posterior to why the ciliary body will form and adjacent to the choroid. The two layers of the optic cup form the pars optica retina. The outer, or posterior, wall is the pigment layer of the pars optica retina, which consists of a single layer of cells. The inner, or anterior, wall of the pars optica retina forms the multilayered nervous portion of the pars optica retina. Anterior to this, the outer wall of the optic cup forms the outer layer of the two cell layers that cover the posterior surface of the ciliary body, pars ciliaris retina, and iris, pars iridica retina. Thus, this differentiated outer wall of the optic cup is homologous to the ependymal layer of the differentiated neural tube that lines the ventricular system in the central canal and forms the epithelial portion of the choroid plexuses. See Chapter 3. The inner wall of the optic cup, posterior to the level of the ciliary body, differentiates into the multilayered sensory portion of the pars optica retina. Anterior to this structure, the inner wall of the optic cup differentiates into a single layer of cells that joins with a single layer of cells of the outer wall of the optic cup to form the two cell layer that covers the internal or posterior surface of the ciliary body, pars ciliaris retina, and the iris, pars iridica retina. Thus, these two layers of cells derived from the outer and inner walls of the optic cup are called the pars ciliaris retina and pars iridica retina, named for the structures that they cover on the internal posterior surface. The rostral extent of the pars iridica retina determines the margin of the iris, which is the border of the pupil. Beyond this structure, the mesoderm neural crest of the pupillary membrane degenerates to produce the pupillary space, the pupil. The outer non-pigmented cells in the pars iridica retina proliferate to form the smooth muscle cells of the dilator muscle of the iris. Thus, ectodermal cells are forming smooth muscle at this site. In the inner wall of the optic cup posterior to the ciliary body, the neuroepithelial cells proliferate as a germinal layer. See Figure 14-3 to initiate formation of the nervous layer of the pars optica retina. With development, this germinal layer differentiates into 3 layers of neurons. The outer layer of cells closest to the choroid and sclera forms the photoreceptor neurons. These neurons are separated from the pigment epithelium of the retina by the collapsed slit-like lumen of the neural canal and are homologous to the ependymal layer of the nervous system. 2 other layers of neurons differentiate in this inner wall of the optic cup. These layers include the layer of bipolar neurons and the ganglion neuron layer. This latter name is another inappropriate use of the term ganglion, given that this collection of neuronal cell bodies is within the CNS. Nevertheless, the name has been retained as the acceptable term. The combined layer of bipolar neurons and the ganglion neuronal layer are homologous to the mantral layer of the neural tube. The nerve fiber layer is a layer of axons from the ganglion cell neurons located on the inner surface of this inner wall facing the vitreous. This layer is homologous to the marginal layer on the surface of the neural tube. The axons of these ganglion neurons course to the optic stalk and grow through it to the brain to form the optic nerve. As these axons penetrate the optic stalk, some optic stalk cells degenerate, others differentiate into the glial cells of the optic nerve. The elegant androglia of the optic stalk myelinate the axons of the ganglionic layer neurons. Myelination proceeds in the optic nerve from the brain to the eyeball. This feature is apparent in the white color of the optic disc seen with the ophthalmoscope on the posterior surface of the eyeball. The area seen with this instrument is the fundus of the eyeball. No myelination occurs in the nerve fiber layer of the retina. In dogs and cats, at birth, the single layer of ganglionic neurons is separated from an outer thick layer of undifferentiated cells that represent the primordia of the photoreceptor neurons and the bipolar neurons. These neuronal cell bodies become separated by the external plexiform layer in the first 7 days of life so that the 3 definitive layers of retinal neurons are established. In retinal development, an overproduction of neurons occurs, which leads to significant apoptosis to attain the normal population by a few weeks after birth. Their normal development and survival are dependent on these neurons forming synapses on neurons in the brain, that is, lateral geniculate nucleus, rostral colliculus, protectural nucleus. Ganglionic neurons that do not make appropriate synapses degenerate by apoptosis. In the chicken, up to 20% of the ganglionic neuron population degenerates in normal retinal development. In the feline fetus, approximately 600,000 ganglionic neurons exist at 47 days of gestation. These neurons progressively decrease to the permanent number of approximately 150,000 by 2 weeks after birth. The histologically mature retina is apparent by 6 weeks of age in the dog, which coincides approximately with the development of visual function. The various media of the eyeball are not transparent until 5 to 6 weeks after birth. The following sequence of development of the eye has been observed in the dog. Gestational days. Day 15. Optic vesicle and lens plaque are well developed. Day 19. Optic vesicle invaginates to form the optic cup. Day 25. Lens vesicle is separated from the surface ectoderm. Multicellular inner wall of the optic cup is differentiated into outer nuclear, mantral, and inner marginal zones. The outer wall of the optic cup remains a single layer of cells. Retinal development progresses from central to peripheral in the optic cup inner wall as a wave of maturation. Day 33. Inner neuroblastic. Ganglionic neuron layer is separated from outer neuroblastic layer. The optic nerve is formed. Eyelid buds meet and adhere. Birth. Retina consists of outer neuroblastic layer, inner plexiform layer, ganglionic neuron layer, and nerve fiber layer. Postnatal days. Day 7-13. The inner and outer nuclear layers of retina are formed. Day 14. Eyelids separate. rabbit, 9 days in kittens. Day 16-35, distinct inner and outer segments of photoreceptor neurons are formed. Day 21, optic nerve is myelinated, pupillary light reflex is detectable. Day 35, electroretinogram, ARG, is first detectable. Day 42, normal retinal histology is developed. The tapetum lucidum develops its normal color by 12 to 16 weeks of age. Before this time, the tapetum lucidum has a blue color when you examine the fundus with an ophthalmoscope, in contrast to the dog with its short gestational period. In the bovine species, the eyeball is fully developed at birth. Studies have shown that the bovine eyeball appears well developed by the end of the second trimester of gestation. The following sequence of development has been observed in the bovine embryo fetus. Gestational size, mm, and approximate days, 6 mm, mm, 26-30 days. Optic vesicle and lens plaque are well developed 10 mm, 30 days. Optic cup is formed, and lens vesicle is separated from surface ectoderm. The multicellular inner wall of optic cup is differentiated into outer mantral and inner marginal zones 14-33 mm, 40-50 days. Inner and outer nuclear layers of pars optic retina are separated 20-40 mm, 40-50 days. Nerve fiber layer is formed. Outer wall of optic cup is transformed from a multicellular layer to a single cell layer 24 mm, 40 days. Optic nerve is well developed 40 mm, 50 days. Eyelid buds meet and fuse 410 mm, 150-180 days. All layers of retina are present. Birth. Eyelids are separated. Histology of the pars optic retina. 10 layers of the pars optic retina are described here, progressing from the outer, scleral, surface to the inner, vitreal, surface. These layers include 3 groups of neurons, 2 types of interneurons, astrocytes, and numerous neurotransmitters. Figure 14-4. Pigment epithelium of the retina. This epithelium is composed of a single layer of cuboidal cells with their base on a basement membrane opposed to the choroid and their apex facing the photosensitive layer across the potential space of the neural tube, lumen of the optic cup. This epithelium is entirely derived from the outer wall of the optic cup. Numerous processes of the apical cell membrane and cytoplasm interdigitate with the processes of the external segments of the photoreceptor rods and cones. In cats, this structure is quite elaborate, with specialized sheet-like projections from the apical surface of the pigment epithelium sheathing the external segments of the cones and, to a lesser degree, the rods. This close arrangement may facilitate the role of the pigment epithelium in the regeneration of rhodopsin, the visual pigment in the rods, and the removal of degenerate rod membranous lamellae by pigment cell phagocytosis. Many melanin granules fill the apical cytoplasm of the pigment cells throughout the retina, except over the area occupied by the tapetum lucidum and the adjacent choroid. The presence of these pigment granules partly accounts for the dark color of the non-tapetal portion of the fundus observed with the ophthalmoscope. The tapetum lucidum in the choroid is rendered more visible by the absence of melanin pigment in this pigment epithelium. These pigment cells in the photoreceptor neurons are nourished by the vessels of the choroid capillaris layer of the choroid. This layer is adjacent to the scleral side of the pigment epithelial cells. Exchange of substances between these choroidal vessels and the photoreceptor neurons must pass through the pigment epithelial cells. Photosensitive layer. The photosensitive layer, divided into 2 segments, represents the dendritic zone and cell body of the special somatic afferent neuron, the photoreceptor cell. The external and internal segments of the layer are composed of modifications of the cell processes in the bodies of the rod and cone cells. Their nuclei are in the external nuclear layer. The external segment of the photosensitive layer represents the dendritic zones of these neurons. For each neuron, rod and cone, the component in the external segment consists of parallel lamellae within an elongate cell process. These lamellae are orderly stacks of flattened, double membrane sacs in the form of discs. These membranes are oriented transversely at the long axis of the cell process. They are formed at the base of the external segment from the modified cilium located there. These membranes are continually being produced. They migrate distally, away from the vitreous, and are cast off at the outer portion, where they are phagocytized by the pigment epithelial cells. In the rods, these membranes contain the visual pigment rhodopsin, the photoreceptor substance responsible for light absorption and the initiation of the visual stimulus. A similar substance, iodopsin, is in the cone membranous lamellae. The rod cells are sensitive to low levels of illumination, night vision, and are more abundant in nocturnal animals. Cone cells respond to high levels of illumination, day vision, and are responsible for initiating color vision. The external segment is connected to the internal segment by a slender stalk containing the modified cilium. The internal segment, called the ellipsoid, is elongated in rods and oval in cones and is composed mostly of endoplasmic reticulum and numerous mitochondria. The ellipsoid is a modification of the cell body of these photoreceptor special somatic afferent neurons. External limiting membrane. The external limiting membrane consists of the junctional complexes between the photoreceptor neurons and the supporting radial astrocytes, the cells of Mueller. These latter cells surround and support all the neural elements of the retina between the internal limiting membrane adjacent to the vitreous and the external limiting membrane, which is on the scleral side of the external nuclear layer between the internal segments and the nuclei of the photoreceptor neurons. External nuclear layer. The external nuclear layer is composed of the nuclei of the cell bodies of the photoreceptors, which are special somatic afferent neurons. The coat nuclei are located adjacent to the external limiting membrane. The rod nuclei are smaller than coat nuclei and constitute most of this layer. They extend in several layers toward the vitreal surface of the retina. In the canine retina, the ratio of rod cells to cone cells is estimated to be approximately 18:1. The number of cone cells increases toward the central area of the retina. Rod cells predominate in the retinas of all the domestic animals that have been studied and are more common in animals that are active during the night when illumination is limited. Axons of the rod and cone cells course vitrally into the next layer, external plexiform layer. The external plexiform layer is composed of the axons and telodendria of the photoreceptor neurons and the axons and dendritic zones of the bipolar neurons and their synaptic arrangements. Intermingled with these neuronal processes are the processes of horizontal cells. The horizontal cell is an interneuron transmitting between different groups of photoreceptor neurons. Internal nuclear layer. The internal nuclear layer consists primarily of the nuclei in the small cell bodies of bipolar neurons, which are the second neurons in the visual pathway and, similar to the photoreceptor neurons, are restricted to the retina. Bipolar neurons connect photoreceptor neurons with the ganglionic neurons in the visual pathway. The dendritic zone of the bipolar neuron is in the external plexiform layer. The axon courses from the external plexiform layer, through the internal nuclear layer, and into the internal plexiform layer, where the telodendron is located. The cell body with its nucleus is situated along the axon in the internal nuclear layer, accounting for its bipolar characteristics. On the scleral surface of this internal nuclear layer are the cell bodies of the horizontal interneurons. On the vitreal surface are the cell bodies of another interneuron, the amacrine cell. This interneuron is in synaptic relationship with the bipolar neurons, ganglionic neurons, and other amacrine interneurons. In addition, the nuclei of the radial astrocytes are located in this layer, whereas many rod cells are in synaptic contact with one bipolar neuron. Only one cone cell may be synapsing on a bipolar neuron. Thus, convergence of rod cell activity on the bipolar neurons takes place. Internal plexiform layer. The internal plexiform layer is composed primarily of the axons and telodendria of the bipolar neurons and the axons and dendritic zones of the ganglionic neurons and their synaptic arrangements. In addition, the processes of the amacrine interneurons extend throughout this layer. Ganglion layer. This neuronal ganglion layer contains the cell bodies and nuclei of the third neuron in the visual pathway. These cell bodies and nuclei are large multipolar neurons with a large cell body and nucleus that comprise an incomplete layer 1 to 2 cells thick between the internal plexiform layer and the nerve fiber layer. This neuron transmits the visually induced impulse to the brain by way of its axon in the optic nerve. Endoplasmic reticulum, Nissl substance, is evident in the cytoplasm of these neuronal cell bodies. These cell bodies vary in size from 6 to 35 microns in diameter. Neurons with the smallest cell bodies have axons that project to the rostral colliculus. Neurons with the larger cell bodies have axons that project mostly to the lateral geniculate nucleus. Functional differences may be found between the medial, nasal, and lateral, temporal portions of the retina. Mean ganglionic neuron size is greater in the lateral retina than in the medial retina, suggesting a greater projection from the lateral retina, medial visual field in space, to the lateral geniculate nucleus of the thalamus for cerebral projection. An increased number of ganglionic neurons are found in the area centralis, where the smaller cell bodies predominate. Remember that the term for this layer, ganglion, is a misnomer because it implies that these neurons are outside the CNS, which is incorrect. Nerve fiber layer. The nerve fiber layer consists of the axons of the ganglionic neurons coursing on the vitreal surface of the retina to the optic disc. These axons are unmyelinated until they penetrate the sclera at the optic disc. Their myelination by oligodendrocytes at this point accounts for the white color of the optic disc. The nerve fiber layer is thickest in the vicinity of the optic disc. The separation of scleral collagen fibers at the point where the axons of ganglionic neurons penetrate the sclera to form the optic nerve is called the area cribrosa. Stellate astrocytes are located in this nerve fiber layer. Internal limiting membrane. The internal limiting membrane is formed by the basal cell membrane of the radial astrocyte and a basement membrane adjacent to the vitreous. Figures 14-5 and 14-6 show examples of these layers in the eyes of the dog and the horse. Area centralis. Humans have a round area for most distinct vision located dorsolateral to the optic disc known as the macula, spot, fovea, or central area. This portion of the retina has the highest resolving power necessary for acute vision. In this area, the retina is composed of only cone cells in the photoreceptor layer, and other modifications occur to facilitate its function for visual acuity. For most precise close-up vision such as reading, extraocular neuromuscular mechanisms are responsible for the visual field being focused on this central area in each eyeball. Domestic animals have various modifications of this area. This area is not readily seen with the ophthalmoscope in any species of domestic animals, except possibly in some cats. In the cat, this area may be identified as a pale streak or oval in the area of the tapetum lucidum dorsolateral to the optic disc in which the blood vessels, arterioles, converge. Figure 14-7. The area itself is devoid of any large blood vessels. In this area centralis in the cat, an increase in the number of cone cells relative to rod cells is found in the photosensitive layer, with an overall increase in thickness of the external nuclear layer. The length of the external segments of the photoreceptor cells is also increased. The bipolar and ganglionic neurons in this area are increased in number as well. The axons in the nerve fiber layer form an arc as they leave the area centralis and course to the optic disc. If the area centralis is defined as a region of the pars optica retina in which ganglionic neuron density increases to a peak, then, in all ungulates, this is evidenced as a streak of high cell density extending horizontally dorsal to the optic disc. This increase in ganglionic neurons is maximal near the lateral end of the visual streak, which corresponds approximately to the location of area centralis in cats. Optic disc. The optic disc, the origin of the optic nerve, varies in shape in the domestic animals, as well as between breeds of dogs, from round to oval to triangular. It is usually slightly ventrolateral to the posterior pole of the eyeball and varies in its relationship to the level of the tapetum lucidum. In toy breeds, the optic disc may be in the retina entirely inferior to the inferior border of the tapetum lucidum. In medium-sized breeds, it is usually halfway over the inferior border of the tapetum lucidum. In large breeds, it may be entirely over the area of the tapetum lucidum. In cats, the optic disc is small, round, and always over the area of the tapetum lucidum. In horses and farm animals, it is just inferior to the inferior border of the tapetum lucidum. The degree of myelination of the optic disc varies among species of domestic animals, being most developed in the dog and least in cattle. The size and arrangement of the blood vessels at the optic disc also vary among species and are the least prominent in the horse and limited to the periphery of the optic disc. Some examples of photographs of the fundus of a normal dog, cat, cow, and horse are given in figures 14-8 through 14-11. Central visual pathway. Optic nerve. The growth of the ganglionic neuronal axons through the embryonic optic stalk produces the optic nerve. In reality, the term optic nerve is a misnomer, given that a nerve is defined as a bundle of neuronal axons outside the CNS and myelinated by Schwann cells. The optic nerve is, in fact, a tract of the CNS based on its origin within the optic cup, which is an extension of the rostral portion of the neural tube that forms the prosencephalon. The axons in the optic nerve are myelinated by oligodendroglia, and this nerve contains astrocytes. The optic nerve is surrounded by meninges and a subarachnoid space. Extensions of the pia course through the nervus septa. This structure has clinical importance because the optic nerve is subject to diseases of the CNS and not the peripheral nervous system. When contrast is injected into the cerebellomedullary cistern on myelography, and the head is lowered to direct the contrast into the cranial cavity, an encephalogram is produced. The contrast in the subarachnoid space around the brain surrounds the optic nerve from the middle cranial fossa rostrally to the posterior surface of the eyeball, forming an optic thecagram. Now, with magnetic resonance imaging, MRI, the cerebrospinal fluid, CSF, in the subarachnoid space surrounding the optic nerve can be identified on T2-weighted sequences. The optic nerves course caudally in the orbit surrounded by their meninges, extraocular muscles, and periorbita. They enter the skull through the optic canals of the presphenoid bone, which have considerable length in the horse. The optic nerves join at the optic chiasm ventral to the rostral aspect of the hypothalamus and rostral to the hypophysis. Optic chiasm and tract at the optic chiasm in domestic animals. A majority of the axons in each optic nerve cross to enter the opposite optic tract. These axons are destined to influence the contralateral occipital lobes of the cerebral hemispheres. Figure 14-12. This arrangement corresponds to the pattern that most sensory modalities that may be localized in space, general proprioception, general somatic afferent, are represented contralaterally in the prosencephalon. The factor that determines whether ganglionic neuronal axons cross or not in the chiasm is the subject of extensive ongoing investigations. Research has shown that the signal molecule, sonic hedgehog, that is produced in retinal ganglionic neurons plays a role in this development. In fish and bird species, all of the optic nerve nerve axons cross in the optic chiasm. In mammals, partial decussation develops in relationship to the development of a binocular field of vision, with frontal positioning of the eyes and the ability to perform coordinated conjugate movements of the eyeballs, including convergence. In primates, in whom this feature is most developed, the degree of decussation is slightly over 50%. Estimates suggest that the degree of decussation in the cat is 65%, in dogs, 75%, and in the horse and farm animals, 80% to 90%. On the basis of this information, the cat most closely resembles the primate in degree of decussation, frontal positioning of the eyes, and presumably conjugate movements of the eyeballs. As the visual system becomes more complex along with the capability for binocular vision, decussation in the optic chiasm decreases. In avian species, decussation is 100%. The Siamese cat and the white Persian tiger have been found to have an increased number of axons that cross in the optic chiasm, which is reflected in an altered lamination of the lateral geniculate nucleus. Congenital pendular nystagmus and a convergent strabismus have been considered to be related to this altered visual system architecture in these species. This feature was described in Chapter 12. The axons that cross in the optic chiasm come from ganglionic neurons in the medial, nasal aspect of the retina. See Figure 14-12. Axons from ganglionic neurons in the lateral, temporal aspect of the retina remain ipsilateral in their course through the central visual pathway. Neuroanatomic studies in the cat have determined that this division between medial and lateral portions of the retina, based on the axons that cross in the chiasm, is a very discrete vertical line approximately through the area centralis. This arrangement was initially determined by cutting one optic tract and studying the retrograde degeneration that occurred in the ganglionic neurons of the retina, the axons of which were severed. Figure 14-13. Studies using horseradish peroxidase injected into the lateral geniculate nucleus of the thalamus have further confirmed this sharp nasodemporal division of the retina. The optic tract's course quadridorsolateral over the side of the diencephalon, progressing from ventral to lateral to caudal in relationship to the internal capsule to reach the lateral geniculate nucleus. This nucleus forms a caudidorolateral protrusion of the metathalamus. See plates 6 and 7 in Chapter 2. Each optic tract contains axons mostly from the medial retina of the contralateral eyeball and the lateral retina of the ipsilateral eyeball. The term visual field is defined as the area in space observed by each eyeball when fixed at any one moment. Therefore, light from the lateral half of the visual field of each eyeball will stimulate the medial retina, and light from the medial half of the visual field will stimulate the lateral retina. Thus, each optic tract contains the axons of neurons in which light generates an impulse from the same half of the visual field of each eyeball. That is, the left optic tract contains the axons of neurons stimulated by light from the right half of the visual field of the left and right eyeballs. Objects in the right visual field of each eyeball are, therefore, represented in the left central visual pathways. When the optic tract reaches the level of the lateral geniculate nucleus, two basic courses are followed. 1. A pathway for conscious perception and 2. A reflex pathway. Pathway for conscious perception. Visual cortex. Approximately 80% of the optic tract axons in the cat terminate in the lateral geniculate nucleus. This nucleus contains neuronal cell bodies organized in specific laminae. A retinotopic anatomic relationship is maintained throughout the central visual pathway. This relationship is reflected in the laminar pattern of the lateral geniculate nucleus. The axons of the neuronal cell bodies in the lateral geniculate nucleus project into the internal capsule and course caudally as the optic radiation in the caudal limb of the internal capsule, which forms the lateral wall of the lateral ventricle. See plate 7-9 in Chapter 2. These axons terminate in the cerebral, visual, cortex on the lateral, caudal, and medial aspects of the occipital lobe. The gyri that comprise this area include the caudal part of the marginal, ectomarginal, laterally, occipital, quadrale, and the splenial, medially, gyri. This pathway from the optic tract to the lateral geniculate nucleus to the optic radiation of the internal capsule to the visual cortex must be intact for normal conscious visual perception to occur. Various portions of the visual cortex have connections to the visual cortex of the opposite cerebrum via the corpus callosum, to the motor cortex of both cerebral hemispheres, to the cerebellum by way of the pons, to the rostral colliculus, and to the mesencephalic tegmentum and motor nuclei of cranial nerves 3, 4, and 6 directly or indirectly through the rostral colliculus. Similar to the arrangement in the optic tract, the lateral geniculate nucleus, optic radiation, and visual cortex on one side of the brain contain neurons stimulated by light from objects in the contralateral half of the visual fields of each eyeball. This route is a retinotopic pathway in that specific anatomic portions of the retina are represented in specific anatomic portions of the optic tract, lateral geniculate nucleus, optic radiation, and visual cortex. These retinal areas have a specific representation in the visual field of each eyeball. In primates, the visual cerebral cortex is divided into functional areas. Area 17 is for vision of stationary objects. Areas 18 and 19 function in panoramic vision for movement, spatial relationship, and depth perception. For normal object vision, interaction is required between the visual cortex and the rostral colliculus. For normal panoramic vision, interaction is required between the visual cortex and the mesencephalic tegmentum. Removal of the rostral colliculus on one side causes hemianopsia in the contralateral visual field for object vision. Bilateral rostral collicular lesions cause blindness for stationary objects. Visual perception of movement and spatial orientation are lost with lesions of the mesencephalic tegmentum. Unilateral lesions of the tegmentum cause a contralateral deficit in addition to causing a severe torsion of the head such that it tilts more than 90 degrees to the side opposite the lesion. Blindfolding corrects this postural dystonia, indicating its visual basis. In cats, functional differences between the medial, nasal, and lateral, temporal portions of the retinal ganglion neurons have been found. These neurons in the lateral retina have a greater projection to the thalamus and visual cortex, whereas more of the medial retinal ganglion neurons projects to the rostral colliculus. After bilateral removal of the visual cortex of the occipital lobes, some visual orienting responses persist in cats. These cats can detect objects introduced into the lateral visual field of each eye presumably by using their rostral collicular projection, which is more abundant from the medial retina. Total bilateral rostral colliculectomy causes immediate inattention to all visual stimuli and loss of both visual placing and the menace responses. These functions return in a few days to a week. Obviously, the cerebral cortex and rostral midbrain have extensive interaction in mediating visually guided behavior. From a clinical perspective, we do not feel confident that we can make an anatomic diagnosis of a rostral collicular lesion. Reflex pathway. 2 reflex pathways exist for the optic tract axons. One pathway subserves the pupillary light reflex function, and the other pathway involves reflexes concerned with somatic motor responses to retinal activity. For the pupillary light reflex, approximately 20% of the optic tract axons in the cat pass over the lateral geniculate nucleus to terminate in the mesencephalic pretextual nucleus or the rostral colliculus. See Plate 7 in Chapter 2. The pretextual nucleus functions in the pupillary light reflex pathway. Optic tract axons terminate in this nucleus. Most of the axons of the neuronal cell bodies in the pretextual nuclei cross in the caudal commissure to synapse in the contralateral general visceral efferent (GVE) parasympathetic motor nucleus of the oculomotor nerve. Thus, light entering one eye will have its greatest effect on the pupil of that eye because of the crossing of the majority of the axons in the optic chiasm and again at the caudal commissure. For somatic motor responses to retinal activity, the axons that course into the rostral colliculus form the brachium of the rostral colliculus, which lies between the lateral geniculate nucleus and the rostral colliculus. The rostral colliculus is also a laminated structure, and, in addition to the optic tract axons, it receives axons from the cerebral cortex, especially the visual cortex, and the spinal cord via the spinomescencephalic, spinotectal, tract in the ventral funiculus. Recall from Chapter 3 that the tectum of the mesencephalon is the roof composed of the four colliculae. Tectonically, axons of cell bodies in the rostral colliculus project to the tegmentum of the midbrain and medulla to influence the general somatic efferent. Motor nuclei of cranial nerves 3, 4, and 6. A tectospinal tract courses quadrantally from the rostral colliculus, decussates in the midbrain, and continues through the medulla into the ventral funiculus of the cervical spinal cord to contribute to the upper motor neuron that influences the lower motor neurons in the gray matter of the cervical spinal cord. These rostral collicular efferent tracts are important in the activation of muscles concerned with the orientation of the eyes, head, and neck in response to visual input. Think of the muscles that are activated for you to follow the action in a sports event or in your response to a flashbulb of a camera. Tectothalamic axons project to the thalamus for feedback to the cerebral cortex, and tectocerebellar axons project to the cerebellum via the rostral cerebellar peduncle. All of these pathways function in the coordination of head, neck, and eyeball movements in response to visual stimuli. Clinical evaluation. Clinical tests. Vision may be tested by watching the patient walk in a strange environment or through a maze of obstacles. Owners may be unaware of a loss of vision in their pet if its activity is confined to their home or yard, and especially if no stairs are available to negotiate. Owners rarely detect unilateral visual loss. In the neurologic examination, vision is evaluated by the Menis response and pupillary light reflexes. Menis response test. The Menis response test consists of making a menacing gesture with the hand directed at one eye while the other eye is covered and observing closure of the eyelids. You may perform this test as you face your patient or while standing over your patient facing in the same direction. Care must be taken not to touch any of the facial hairs or to create too much air turbulence because palpebral and corneal reflexes will be elicited. Cover one eye with your hand that is holding the head and lightly tap the eyelids or the side of the face of the eye being tested so that the patient is aware of the test and to be sure the facial nerve functions normally. The Menis response is a learned response that requires all of the components of the visual system pathway and connections from the cerebrum to the brainstem with activation of the facial neurons in the medulla. Being a learned response, it is often absent in young animals. It is, however, usually present in foals and calves by 1 to 2 weeks of age and by 10 to 12 weeks of age in puppies and kittens. In patients with facial nerve paralysis, look for retraction of the eyeball away from the menacing gesture, which will be indicated by a brief protrusion of the third eyelid. Occasionally, the patient will retract its entire head away from the gesture. On the basis of the observation of numerous kinds of lesions located in the prosencephalic components of this visual pathway, it has been established that these areas are all necessary for the perception of vision required for this Menis response. Experimental studies have defined a role for the rostral colliculus in the normal Menis response, but the rarity of lesions localized to one or both rostral colliculi does not permit any similar clinical conclusion. In all domestic animals, diffuse cerebellar disorders, especially those that involve the interpocital and lateral cerebellar nuclei, have often been observed to cause a failure of the Menis response to elicit eyelid closure bilaterally. The palpebral reflex is normal, as is their vision based on eyeball or head retraction and the ability to negotiate around obstacles in an unfamiliar environment without bumping into them. The assumption is either that the pathway that mediates this response passes through the cerebellum to reach the facial neurons, figure 14-14, or that the cerebellar lesion causes inhibition of the cerebrocortical neurons involved in this response. An anatomic pathway was described in Chapter 13 on the cerebellum that involves a synapse in the pontine nuclei, a cerebropontocerebellar pathway. Alternatively, a pathway may involve the rostral colliculus with or without a pontine relay, a cerebropontocerebellar pathway, 122 or cerebropontocerebellar pathway. See video 13-23 and video 13-24 in Chapter 13 for a good example of this feature in Arabian foals with a diffuse cerebellar cortical abiatrophy. In the horse and the dog, we have observed a unilateral loss of the Menis response in patients with a large unilateral cerebellar lesion on the same side as the Menis deficit. This loss may be explained by the crossing that occurs from the cerebrum to the cerebellum at the pontine nucleus. See figure 14-14. Pupillary light reflex. The pupillary light reflex was described in Chapter 7. Figure 7-1 highlights this pathway. The cones are probably the most receptive to this bright light stimulus. Light should be directed toward the lateral, temporal, retina, where the area centralis is located. This procedure tests the visual components of the eyeball and the central visual pathway to the level of the mesencephalic pretextual nuclei at the junction of the thalamus and midbrain. The light reflex pathway continues to the adjacent GVE preganglionic parasympathetic neurons of the oculomotor nerve in the rostral portion of the mesencephalon that mediate the motor response. No involvement of any component of the cerebrum occurs in this reflex. Recall that the direct response to light directed into one eye is greater than the indirect, consensual, response in the other eye because of the major idioptic nerve axons crossing in the optic chiasm and the majority of the pretextual nuclear axons crossing back through the caudal commissure. This feature is more pronounced in horses and farm animals than in small animals. Lesions in the afferent, visual, portion of this pathway must be severe to cause a loss of this reflex. Remember that the rate of pupil constriction varies among species of domestic animals, being most rapid in cats and slowest in horses. Occasionally, when this reflex is tested, the bright light causes the eyelids to close. This reaction is called a dazzle reflex, or squint, and involves optic tract axons that synapse in the rostral colliculus and tectonically axons that synapse in the facial nucleus to elicit this motor response. This route is a brainstem pathway similar to the pathway for constriction of the pupils and does not involve the cerebrum. Clinical signs. See Table 14-1. Refer to Figure 7-1, which will help you determine what to expect with the following location of lesions. The degree of visual deficit depends on the location and extent of the lesion in the visual pathway. Lesions that destroy the retina or optic nerve in one eye cause blindness and a normal to slightly dilated pupil in the eyeball. Pupil size may be normal in the affected eye if enough light enters the normal eyeball to stimulate both parasympathetic nuclei of the oculomotor nerves. This lesion does not usually cause any disorientation observable in the gait or posture in domestic animals. No head tilt or any neck curvature is observed. In birds, The lesion may cause a head tilt toward the blind eye. This avian feature may reflect the lack of any uncrossed optic axons at the optic chiasm. No palpebral closure to the menace gesture made toward the affected eye is observed, but the palpebral reflex is normal. Light directed into the affected blind eyeball produces no response in either eyeball. Light directed into the normal eyeball causes both pupils to constrict. In the pupillary light reflex pathway, many of the afferents cross both in the optic chiasm, as well as in the protectum, to influence both parasympathetic nuclei of the oculomotor nerve. Observing both eyes simultaneously is often difficult. The best way to observe the pupillary response in both eyes is to swing the light source, which is held close to the eye, continually from one eye to the other and back again. This action is called the swinging light maneuver. The speed is determined by how fast you can observe the response in the eye when you swing the light to the eye. As you swing the light from one eye to the other, both pupils constrict when the light is directed into the normal eyeball. However, as the light swings back to the affected eye, that pupil will be dilating back to its original size in room light. If the pupil had not constricted when the light was directed into the normal eye, no change would be seen when the light was moved into the affected eye. If you cover the normal eye with your hand, the pupil in the affected eye will dilate because you have eliminated the only source of light to the oculomotor nuclei. Bilateral retinal or optic nerve disease that is total causes blindness with both pupils widely dilated and unresponsive to light directed into either eyeball. Sudden acquired retinal degeneration syndrome, SARDS, and optic neuritis are each a common cause of this. Ordinarily, very severe retinal or optic nerve lesions are needed to prevent the pupils from constricting to a bright source of light. In most instances, vision will disappear before the loss of the pupillary light reflex. Therefore, an animal may be blind from retinal or optic nerve disease but still have pupils that respond to a bright source of light. However, the pupils may be slightly dilated in the relatively subdued room light. Remember that the light source used for the pupillary light reflex should be very bright, and if any retinal or optic nerve axons are intact, a pupillary light reflex will be observed. Another way to consider this factor is that as the disease process progressively interferes with retinal or optic nerve function, vision will be lost before the pupillary light reflex. If blindness occurs slowly and the patient is confined to a small environment, the visual deficit may not be noticed by the owner. Blind animals may adjust well to their normal surroundings. Owners often describe an acute onset of blindness in their dogs that have either SARDS or optic neuritis, both of which are progressive diseases. These patients have undoubtedly been losing their vision for some time, and only when most of these structures have lost their function does the patient appear to be suddenly blind. Unilateral lesions in the optic tract, lateral geniculate nucleus, optic radiation, and visual cortex result in a visual deficit in the contralateral visual field of each eyeball. Because of the degree of decussation in the optic chiasm, the visual deficit can be appreciated only in the contralateral eyeball. This abnormality is called hemianopsia because a visual field deficit occurs in 50% of the total visual field. In the dog, this level represents approximately a 25% loss of vision in the ipsilateral eyeball and a 75% loss of vision in the contralateral eyeball. In the dog and the cat, the visual deficit is most evident in the failure of the menace response in the contralateral eye. This aspect is very reliable despite the still intact function of the 25% of the visual pathway that is intact because of lateral retinal neurons that do not decussate in the optic chiasm. The visual deficit may be difficult to detect as the patient moves around in its surroundings. Occasionally, an object may be bumped on the side opposite to that of a lesion. However, in many instances, no evidence of a visual deficit is observed. Unilateral blindfolding and maze testing of the patient may be helpful. In the large animals with 80% to 90% of the optic nerve axons crossing in the optic chiasm, a greater tendency exists for the patient to walk into objects on the side of the visual deficit, contralateral to the lesion in the central visual pathway. All domestic animals with a unilateral lesion in the central visual pathway exhibit a poor to absent palpebral closure response to menacing gestures to the eyeball that is contralateral to the lesion. If the examiner is careful, this test can be reliably performed without using a transparent barrier between the hand and the eyeball to prevent air currents and direct contact with facial hairs. Dropping or throwing a cotton ball and watching to see if the patient tracks it with its eyes, which some recommend instead of the menace test, is, in our experience, unreliable and awkward to perform. In small animals, the eye not being tested must be covered by menacing the exposed eye from both the medial and lateral visual fields when a lesion exists in the contralateral visual pathway. You may determine that the deficit is more pronounced when the lateral visual field is tested because the crossing optic nerve axons arise from neuronal cell bodies in the medial retinal ganglion cell layer. In unilateral lesions of the visual pathway caudal to the optic chiasm, the pupillary light reflexes are usually normal. The logical assumption is that a unilateral lesion in the optic tract will cause a decreased pupillary light reflex in the contralateral eyeball because most of the optic nerve axons cross in the optic chiasm and most of the axons of protectable neurons cross back to the oculomotor nucleus on the side of the eyeball that is stimulated. See figure 7-1. However, in our experience, this difference in the response of the pupillary light reflex between the two eyeballs with a unilateral optic tract lesion has been difficult to appreciate. Bilateral lesions in the optic tracts and the lateral geniculate nuclei that involve the pathway to the protectural nuclei, if complete, will cause blindness with dilated pupils that are unresponsive to light. More often the lesions here are partial, and clinical signs are difficult to determine. This is supported clinically in canine distemper virus infection, which often produces extensive demyelinating lesions in the optic tracts without obvious clinical deficits of vision or pupillary function. The central visual pathway from the lateral geniculate nucleus to the visual cortex contains no neurons in the pupillary light reflex pathway, and therefore lesions here cannot interfere with this reflex. Bilateral lesions here can cause complete blindness with normal pupillary light reflexes. Diseases of the visual system. Abnormal pupils. The following 4 case examples provide cases of clinical disorders that involve the pupillary light reflex. See Table 14-1 in the description of similar clinical disorders in Chapter 7.